My motivation to become a surgeon was that I liked the ability to treat patients in a comprehensive way. That is, we had the best medical therapies, but we also could do the interventional things like an operation on patients. And I particularly liked general surgery and vascular surgery because they allowed you to operate in a variety of anatomic areas. We'd operate in the neck, in the chest, in the abdomen, and in the extremities. So the variety was key. The critically ill nature of the diseases you treat was important. And frankly, there's a certain gratification that the patients actually tend to get well when you're done with your operation. I think that the balance of being able to really help somebody and see it in a very concrete way is extremely gratifying. Again, it's not, the longitudinal follow-up is measured in months, sometimes years, but it's not a day-to-day chronic illness. It's an acute problem that gets fixed, and then the patients are well again. Any residency, by definition, is attracting very intelligent people. And, just to get into medical school takes a certain amount of talent and ability. The students who then gravitate towards a surgical career tend to be very much can-do type of people. They are focused, they're motivated, they are intelligent, and they get the job done. They can move from point A to point B in fairly rapid fashion, and they're just a delight to work with. They obviously have to like people because it's a fairly intense specialty. They have to be reasonably comfortable working with their hands. It's not to say that it's a craft. It is a learned profession, so they have to be smart and able to kind of walk and chew gum at the same time. The technology is changing dramatically. It used to be everything was done with open surgical procedures, a scalpel and big open incisions. And now a lot of it is done with minimally invasive technology. So there's laparoscopic, endoscopic, endovascular procedures. And the new technology is in fact challenging. The other thing is that the understanding of the biologic processes that underlie surgical practice has just gone exponential. There's way more drugs. They're way more effective than they used to be in the past. We have a whole lot more to learn, and also newer technologies to assimilate. And then the same amount of time for residency training, same number of years, and a reduced work hour distribution. So we've got a lot of material to get into a short period of time. My consistent advice to medical students of any generation and going into any specialty is to follow your heart. If you're wise enough to think about what will keep you happy when you're 40, 50, and 60, then your decisions made at 20 and 30 will make a lot more sense. But follow your heart. If you love doing primary care, do primary care. But if you love surgery, go and follow your heart. I think that's particularly important for women medical students who often get the advice that, you've got to take a controlled lifestyle. You can control your lifestyle in any specialty. It's a matter of arranging your schedule, time management, having good partners, and so on. So follow your heart, do what's going to make you happy when you're 50 and 60 years old.